Hi everybody, welcome to this new free webinar organized by ECCRT. So my name is Nels Stockard and I will be your facilitator for today. So if you have any connection issues or problem or question, don't hesitate to use the question system. I will be there to answer them. You will stay muted during the whole webinars, but of course all questions you may have will be collected and will be answered at the end with Alison, that I'm really happy to introduce you. Alison Roberts is our trainer for today. She is a very experienced auditor and she's also providing some training for us. And she will today providing you this training. What you have to know also is that this free webinar is recorded and will be available on our free resources on our website. So Alison, I give you the floor now and I will stop sharing my camera.
Thanks, Nella. I will welcome to everyone who's online. I see we have quite a lot of people, and that's great. I'll just introduce myself, and while I do that, I'll put on my webcam just so you can see there's a real person here at the other end of the line. Now, I hope you should be able to see me on the webcam. Okay, so I would just like to, as I say, welcome you all. As Nella has explained, I've been working in clinical research for many, many years, starting from 1979 when I first graduated, which is a very long time ago. I started in the organization and running of studies. Things were very different in those days, as you can imagine, I'm sure. I moved on through clinical research, various different activities, into clinical QA and auditing, starting in 1991, so quite early in the days of GCP auditing. And I worked in a major pharmaceutical company for 6 years, and then in one of the big CROs after that. Since 2001, I work for myself as coauditus, and I'm involved in training with ECCRT. Okay, so I think we can go back to my slides. I might well put the camera back on at the end when we have some questions. Okay, voila. So here we are. You should all be able to see my slides. The question today is, how much can we learn from an investigator site audit? And it's an interesting question. I think we'll see exactly whether you find some of the topics I've chosen useful. So here is first a little poll question. I'd just like to know how many of you have ever participated in an investigator site audit. So if you would like to respond yes or no to the slide that Nella has just put up. Okay, that's very interesting. I guess you can see the results on your screen. It's exactly 50-50. So that's a very interesting result. Thank you for that. All right, we'll move on to the next slide. What I'm interested in and what I think is an important point to consider is how much use is actually made of audit observations. We make a lot of audit observations when we conduct investigator site audits, but I'm not actually sure how well they are used. And my feeling is that you could get more out of them than you actually do, or than most companies do. So here is a typical, to me, what is a typical post-audit scenario. People are usually saying to themselves, let's get this out of the way as soon as possible. And so what they do is they answer the observations very quickly in a CAPA plan, a corrective and preventive action plan. And most often this is done at the study level or the project level. And this means that the wider implications of the findings may not be fully exploited. So the question is, can we make better use of this information? How can we do this? So here's another little question. If you have participated in a site audit, did you actually learn something from it? Now, this question obviously only applies to the 50% of the participants who have participated in an investigator site audit. That's very encouraging result. What I can see on my screen is that for 81% of the people who have taken part in a site audit, they did feel they learned something from it. Now, that's really encouraging for me as an auditor, because one of my measures of how well an audit has gone is whether the people say to me afterwards, it was really useful and I did learn something. And that can be the monitors, that can be the site staff, and I often learn things as well, even now. Okay, thanks, Nella. We'll go back into the slides. Okay, so what I've done is I've chosen 3 examples, and I'm just going to try and just bear with me a moment. I'm just moving my my panel so I can see my own slides a little better. Okay, I've chosen 3 examples that I personally have seen where there were wider implications that could or could not have been exploited following the audit. The first example concerns investigator medicinal product, IMP, dispensing and returns. And in this case, the finding was that the pharmacy was not completing IMP dispensing and return logs in timely fashion. And the monitor had actually already reported this as an issue. And what did we find? We found that the form provided by the sponsor was not adapted to the type of IMP being used in the study. In this case, it was intravenous chemotherapy. In addition, the pharmacy, this wasn't really an issue, but what we did note was that pharmacy had their own complete records. The sponsor's forms had been completed, but they'd been completed rather late at the monitor's insistence. So that's the setting of the scene, if you like. So what was the lesson in this case? The lesson learned for me was that the template provided by the sponsor in such cases needs to be adapted to the type of product being used. In this case, the form the sponsor had provided was really for counting tablets and capsules and didn't apply to a dispensing of an IV product where it was dispensed and returned the same day, and the actual IV bag didn't come back to the pharmacy. It was destroyed according to their usual procedures. So the second bullet under the lesson, this should be used in future at all sites and in all studies using similar products. So revise the form and use it not just for this product, but if you have any similar studies with similar products. There's also a question here, was this form actually needed at the site? Because as you saw before, the pharmacy had their own forms, which were pretty adequate and following their own procedures. And this was all clearly documented. So maybe they didn't even need to use the sponsor's forms in this particular case. So the conclusion here is that this observation allowed changes to be made to improve the quality of the sponsor's documentation across the board, so across projects and studies. Okay, let's move on to the second example. In the second example, we have a PK sample labeling example. And the finding in this case was that during a central lab audit, errors have been noted in the PK sample labels coming from this particular site. So in advance of the audit, there had already been some information about errors in the PK samples. And this is just to diverge a little bit. This is something that is really important in investigator site audits. It's to really prepare upfront and to have as much information as possible before you go to the site. And in this particular case, the sponsor had already conducted a central lab audit. And this is where they'd seen the errors in the sample labeling that were coming from the site. And during the site audit, we looked at this and confirmed that it had indeed been a problem. What had happened? What were the issues? The site staff had been confused by the sampling numbering on the labels provided by the sponsor. They'd actually started labeling, numbering and labeling in a certain way, and then it changed halfway through the study, and the site staff really got very lost in these type of labels. And in fact, we, the auditors, agreed that the sample numbering was indeed confusing. Fortunately, we were able to confirm from the records at the site that the samples had been taken at the correct time points. So there was a logbook where they'd actually logged the sample times, and we could see that there hadn't been an error in the actual sampling. It was an issue to do with the labels. So what was really the lesson here? So I think often people who design labels for these kind of studies are working apart from the clinical team and away from people who are actually going to use the labels in a busy clinical environment. And for them, it seems very clear and logical, but for the staff at the site, perhaps it's not so clear and logical. So I think that the lesson here is that PK labels should be coherent and very easy for the busy site staff to be able to understand and to improve compliance. The conclusion here was that after this audit observation, the sponsor decided to change the way the PK labels had been printed and the content to try to make them more user-friendly in future. I've seen similar issues with labeling of PK samples where, for example, the samples, the labels don't stick to the tubes very well, and they can fall off during transport, or the labels are too big or too small. So this kind of problem, this is one illustration of the problems that you can have, but this kind of problem can happen quite frequently. And of course, if you lose a label from a PK sample, the sample cannot be exploited, and you've in effect lost the sample. So this was a very useful lesson for the sponsor. Okay, let's move on to the next example. Now this one is to do with query handling on electronic case report forms. And this is something, I've got one example here, but this is something that causes a lot of problems and is very, very frequent. And any of you that are listening in today, I'm sure who've been working with electronic CRFs will perhaps recognize this kind of issue. So here the finding was that the monitor had already reported several times that the site was behind with answering queries on the ECRF. So queries coming back regarding the data that had been entered in the ECRF. During the site audit, we found that this was still the case. There were still many queries outstanding during the site audit. Now, obviously, this isn't good because sponsors are trying to keep their databases up to date and have clean and final data in them as soon as possible. If there's a big backlog of queries, it really does delay, for example, safety reviews and other data management tasks. So what was the problem really here? What was the issue? The issue at this site was that the data manager was completing the ECRFs in timely fashion, but the number of queries generated was extremely high. So the person at the site, the study coordinator or the data manager, was actually doing their job quite well. They were filling the data in as soon as they had it. But despite this, the queries were very high. The data manager had been trained, so it wasn't a training issue. And they were really trying to do the best job that they could. These many queries, these were mainly queries on missing data. So data that had been entered as not recorded, not applicable, or not done. And these NR, NA, ND, I'm sure you're familiar with these, had been entered when the data was really not available, and when it had been verified by the monitor, validated by the monitor, and according to the ECRF completion guidelines. So these were correct answers in the context that, yes, they were really not done, or they were not reported, they'd been forgotten maybe, and the monitor had checked and said, yes, there is no data, or this was not relevant. However, the queries were still being generated. The lesson here is that query loops should be much more efficient, so that when such response is entered by the data manager and validated by the monitor, it doesn't generate queries. Now, in many ECRFs, this does work quite well, but there are a certain number, and it depends how the parameters are set up at the beginning, where these query loops are not efficient. And the problem is that it generates a big sense of frustration at the site. I remember being told by one of the study coordinators that she had gone away on Friday evening and had got down the number of queries down to 20, and come back on Monday morning and there were 500 waiting for her to reply to. So it's a little bit discouraging for site staff. And there are also queries that lead one to another, and so for the same question, there may be 5, 6, 7 queries on the same topic. So it's not efficient. And these query loops need to be more efficient. Again, the people who design the query loops and design the databases are not the same people who are going to have to be working with these case report forms and working with these queries on the ground, in the field, at the hospital, where time is important and where there may be many other studies running. Believe me, if your study has a very complicated ECRF and it has complicated data entry, data query loops, you may find that the site staff choose to complete another company's CRF first because it's easier. So what is the conclusion from this third example? This audit observation for me allowed the query loops across all the studies using this same ECRF, so from the same supplier, to be rationalized, and this reduced the workload at the sites, or to all the sites involved. And what it meant was they increased the efficiency of data collection and data cleaning. So this was, again, something that had to be taken into account in future studies. It wasn't really something they could correct immediately for the study that was ongoing, but they did take it on board and correct it for remaining, and also for any future studies where they were using the same type of ECRF. Okay, so I'm hoping you're going to have a lot of questions on this. So my conclusion here at the moment is that the auditors unique and independent view can contribute to the quality and efficiency of your studies. Why is our view unique and independent? Well, it's because auditors look at studies across the board. We look at different projects, different protocols, different products, and in different indications. So we do indeed have a unique and independent view. And I believe that this view can really help improve your studies. And what I would say is make the most of every single observation. Okay. So this is just a little introduction to the kind of thing that I will be talking about, that I do talk about, related to site audits. And I'm going to be conducting an introductory course to investigator site audits in April. And if you're interested in knowing a little bit more, please do sign up. You have an idea of the kind of examples and the kind of experience which I will share with you, and I'm always very happy to share. And the course includes practical exercises, and it also includes some role plays, which are usually great fun, as well as being serious and helping people understand some of the pitfalls and the risks of doing investigator site audits. Okay, I would just like to say thank you very much for your attention, and perhaps hand back to Nell.
Yeah, for sure. Listen, now it's time for questions. So if you have any questions, don't hesitate to ask questions via the system. So I have a thank you as a question. So, but if we can have some questions, so I let you think about it. And in the meantime, I have some for you. Listen. Maybe you can answer it, and what I could do is maybe put the camera would be nicer so we can see each other. Wait a minute, webcam, okay. So you can see me, and I can see you. Hi, Alison. So the question I have for you is, what are the ways these observations can be more widely communicated to management across projects?
Okay, so the question is, how can these type of observations be shared across projects and communicated? That was the question. Okay, I would say usually quality assurance groups have a system for sharing audit observations. It usually is done by quality assurance through their regular routine procedures in meetings with senior management across all projects. So they can say, for example, we have found this and this and this observation over the past 3 months, 6 months, 1 year, depending on how many audits you conduct in your company and how many projects there are, how many findings you have. But the main message is really that these findings need to be communicated at a high level. Very often they don't get past the actual project or the protocol or the study that's going on, and they don't get communicated higher up. To get changes made, you need to really, QA needs to share them with senior project managers, and without pointing fingers and saying this project did this wrong and this project did this wrong, but really to say what can we learn to improve the overall quality of our studies.
Thank you. I hope it's happening time to time. So my experience is it happens, but it's not that easy sometimes. Not blaming people, I mean.
Yeah, exactly. I agree.
And what do you think? Won't this type of approach delay the closure or finalization of a CAPA for that audit?
Yes, the question is, could this approach delay the closure of the CAPA plans? Now, when I'm running a when I'm often asked to review CAPA plans and have a look and see if there are any areas in which we could just to check that what is stated in the CAPA plan is reasonable. Now, if there is a system-related finding that, for example, let me take the label issue. If there is an immediate answer which says the sample labeling will be checked and we will make sure that the correct samples have been identified at the central laboratory, that's the immediate corrective action. But in future, for a preventive action, it might be the label will be redesigned to make it more user-friendly, and we will incorporate this into a review of all our labels. And that date for completion can be planned date in 3 months' time. So the CAPA plan can be closed with a date that says we agree to do it on a certain date by a certain date. And of course, QA can then go back afterwards and say, show me what you've done, show me your CAPA plan, and show me that you actually did this within the time frame. But it shouldn't delay the closure of the CAPA plan.
But then it means that we have to ensure that QA is following up closely.
Sorry, I couldn't hear you. Were cut off a little bit.
Oh, sorry. I said, so you have then to ensure that QA is following up that closely afterwards.
I missed the end, sorry.
So I said QA should then follow up closely that the action took place because it's 3 months later. So
yes, I mean, quality assurance can actually, usually what we say is that we reserve the right to audit CAPA plans at a later date and ensure that everything that you say you'll do has been done. But one of the problems is that when there are a lot of audits in a company, it's very difficult for QA to review everything. So most QA teams have actually stopped systematically doing it. But what they say is, we may come back at any time. And some of the CAPA plans can actually be reviewed. For example, you can pick up audit findings, say, concerned with the PK labels. If a central lab audit is done and you're looking again at PK samples, you can look and say, well, did they actually review their labels like they said they would do? But it shouldn't stop the CAPA plan being closed. Remember, also, a CAPA plan is the responsibility of the team and not of QA. So QA can say, yes, this looks okay to us, but the responsible people for implementing it are actually the project team.
Ah, okay. And in what other areas can this approach be useful?
Sorry, I missed that.
Yeah, so in what other areas can this approach be useful, do you think?
In what other areas of clinical trials? Well, it can be used, for example, I would say in the design of the ECRF. We talked a little bit about the query loops, but it could be used also in the design of the ECRF. It can be used in informed consent, design of informed consent. If we had a few hours here, I would be able to talk to you a little about informed consent, because that also is an area where there is a lot of room for systems improvements. For example, multiple versions of consents in many studies, using the possibility of using a short consent. If you find that there are many versions, you can use a small summary consent. So these are system-related problems, and again, sometimes they don't get pushed up to a high enough level for them to be implemented across the board. there are also protocol-related issues where similar protocols are used for several studies, and there are standard issues which come up every time that those type of protocols are reviewed, and those issues that apply across protocols could actually then be moved into the system level and changed and updated.
Okay, thank you very much for your answers. It was really interesting. I will maybe take it over for the end of the training, but I will stop my camera. So, if you still have questions, don't hesitate. But we have, in the meantime, a question for you. We would like to know if you find this webinar useful. So I will launch the poll. So that's interesting. So in fact, you said mainly yes, but we'll still have some no. So I hope that it's no because you already used the audit finding for this type of lessons learned. So I said, I hope that the ones said no, it's because they already use the audit findings to improve their process internally and to share it with the other project team. Now, what are the next steps? Sorry, I will hide the poll. So now, what is the next step after this webinar? As I mentioned at the beginning of the webinar, this session is recorded and it will be available on our website at the latest on Monday. So don't hesitate to go to the website. It's under free resources. You have all free webinars recorded that are posted there, but you have also a blog where you can find some information regarding trainings, regarding clinical research that could be useful for you. So also what you have to know is that you will receive by email online feedback survey, because for us it's still new to organize free webinars, so it's interesting to know how we can improve and if you learn something, because it's the aim of this type of webinars is to ensure that you learn something. And of course, feel free to leave us some information about it. And that's it. If you have any questions still about these topics or under any trainings regarding audits, because we have a full program of trainings regarding audits, how to make them, don't hesitate to contact us on info@ECCRT.com. And I'm taking this opportunity to really thank you a lot, Alison, for the time she spent to prepare this webinar, to do it, and to share all she learned from these audits. And I've been there during her courses, during this role play, and she's really doing that really well, and it's very useful. And it is really in the same spirit than this webinar. So thank you a lot, Alison, for that. So now, thank you for all of you, and I will close the webinar.